Welcome to the African Population Conference hosted in Malawi by the Union for African Population Studies. The Family Planning News Network is here for the first reporting trip with a few community reporters reporting directly from the conference and a few journalists around Africa from the region are joining us to go into the community. We're going to Dedza to meet with Chief Kachindamoto to talk about child marriage, and we're going to Dzaleka to talk to community voices and really speak about how we can leverage Africa's human capital to achieve transformation in a world of uncertainty. You're with me, Nthanda Manduwi, your FPNN community host. Joining me is the outgoing president of the Union for African Population Studies, Dr. Beguy. Dr. Beguy has 15 years of experience in research, capacity building, and knowledge translation in the population and health field. His research areas include adolescent health, particularly reproductive health, urban health, migration, and urbanization. Welcome to the conversation, Dr. Beguy.
Thank you.
So it is public knowledge that Africa is experiencing a demographic dividend, and efforts are underway to tap into this Africa's very youthful population. Now, statistics say by 2051, Africa is expected to reach a ratio of 1.7 to 1 working age group to dependents, so almost 2 to 1. And I think this aligns with the theme of this year's conference, this year's 9th African Population Conference. And the theme is leveraging Africa's human capital to achieve transformation in a world of uncertainty. So I know you have a lot of experience in research, and I want to know, based on your research in urban health and demographic dynamics, what are the key strategies Africa should adopt to effectively leverage its human capital for sustainable development?
Thank you. I think that we need to look at issues of education and skills, employment and entrepreneurship. There's also health and well-being. At the heart of it also is also governance. For Africa, you need to look at issues of governance. One key element is education, quality education, women's empowerment. That's at the heart of it. You need to educate the girls. You need to ensure that they spend enough time in schools and get quality education that will help them, that will keep them out of early marriage, for example. Yes. That will help them improve their job prospects. And there is a ripple effect in terms of taking care of their family. So you will also improve the child, the sexual and reproductive health outcomes that way.
Okay, a youthful population that needs upskilling, preparation from the job market. All right. So you have conducted significant research on urban health and migration, particularly in informal settlements. I want to know, what are some of the main challenges and opportunities that you have identified in improving specifically health outcomes in urban areas?
So it's often said that the battle for sustainable development will be won or lost in cities. For many years, people thought that the urban health, the health of urban dwellers in general, is much better than that of those living in rural areas. But then research showed that, look, there are many disparities, a lot of disparities within cities, especially there is research evidence showing that people living in slum settlements, for example, have worse health outcomes than those even living sometimes in rural areas. Children living in slums are more likely to die before their 5th birthday, for example, than children living in the rural areas in some cases. So we need to ensure that, and as the numbers of people living in slum areas increase, it means our development indicators in urban areas will always be, taken down by this increasing chunk of the population. So we need to look at and reduce the disparities. It is target those slum areas. How, for example, you ensure the government invests more in those areas to ensure that those living in informal settlements access the same kind of service, health services, for example. So I think and at the same time, cities also offer opportunities. These days, Nairobi is a city full of young people with IT skills, and how can we, why don't we take advantage of that to ensure that, targeted investment to help them, show their skill, to help them, get out of poverty.
Yeah. Now, you speak of something that was very interesting. When we think of health in cities, we're thinking these people are already privileged. And you spoke of slums, and a lot of the bigger populations are there. So I think when we're targeting our health policies and initiatives, we're going to the rural areas and we're leaving out this because we think the cities are already privileged. I think that was really interesting. So migration and urbanization are central themes to your work. How do you think these factors influence population health, and what policies can be implemented maybe to address the health needs of migrant populations, especially in these African cities?
So again, the migrants flocking in cities in general end up living in those
Informal settlements.
in the informal settlements. You need to ensure that the policies that are put in place, government need to ensure, or maybe local authorities, there is a specific investment, intention in those areas. The migrants also end up living in not having enough job prospects, for example. They have poor working conditions, for example, and sometimes it also affects their health.
Absolutely.
So that also needs to be looked into. For example, they can have specific strategies that will prevent exploitation. For example, it's important that governments, either at the local or national level, ensure that those who are living in those areas, they are their health is also taken care of, as part of the global population, the urban population or the national population in general.
The young people. And when we speak of adolescent health, particularly their reproductive health, I know this is a critical area of your research. So what interventions have you found to be most effective in addressing the reproductive health needs of adolescents in African urban settings?
So the young people or adolescents make a chunk of population, urban populations, and the reality is that they often grow up in such a hostile environment, especially those in urban, in slums, urban slums, and that affects their lives, and including the mental health. And what we found is that we need to interventions that are designed need to take a sort of multi-sectoral approach. In those interventions need to address the underlying causes of the health conditions. Look at education, poverty, gender-based violence, for example. You need to look at those interventions. So, for example, how can you give young girls, for example, life skills, comprehensive sexual education, for example. How can you help them have life aspirations, influence their life aspirations, influence maybe the financial literacy, to help them think out of the box. These are some of the options that all put together will somehow help young girls and us in slums get out of poverty.
As the outgoing president of the Union for African Population Studies, we are at the 9th APC. What is the one key message you want people to walk away with from this APC with regards to public health and family planning?
Well, we need to continue investing in human capital, okay? And that part of it, part of improving human capital is also ensuring that girls and women have access to family planning services. And we need homegrown solutions. We have homegrown solutions, of course, and with resources from within. Of course, you can always get help from outside, but I think you need to look at it inside and look. How can we ensure that our women, African women, African girls, they have access to family planning services to realize, their fertility preferences, if they, so that at the end of the day, they realize their full potential in terms of, education, job opportunities, employment, for example. So the message really, we still need more investment, capital on family planning services to ensure that our girls and women realize their full potential. Yeah.
Thank you so much.
Yeah.
Homegrown Solutions,
Yeah.
Continued Investment. That
Yeah.
was Dr. Beguy, the outgoing president of the Union for Africa Population Studies, sharing his insights on what works, in what context, and why. You were with me, Nthanda Manduwi, FPNN host. Thank you.